Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, from the basketball court to the soccer field, the tennis court to the swimming pool, youth sports can be a great way for kids to be social and be active. Kids can also learn the importance of teamwork, sportsmanship, perseverance, and even, hopefully, respect for authority and the rules.
Respect,
Yeah,
you say.
Respect.
But youth sports also come with some risks. Things like concussions, knee injuries, and shoulder problems can all be a part of taking part in athletics. Here to talk about youth sports, pros and cons, is orthopedic surgeon and co-director of the Mayo Clinic Sports Medicine Center, Dr. Mike Stuart. Welcome back to the program once again, Dr. Stewart.
Thank you. Glad to be here.
Yep, good to have you here. And I remember the first time we did this back in 1991, wasn't it?
That's right.
Yep, June 1991.
The very first
guest. And here he is again. This is appearance number 29, probably. Great to have you. So organized youth sports, I assume you're in favor?
Very much so. I think sports have a lot to offer. Clearly there's risks and benefits, but certainly a lot more benefits.
I just want to know the amount of time. How long ago was that you said? What has changed in your practice over the 20-some years that you've been practicing and helping with sports?
Well, neither one of us has aged. I know that. We both look the same.
I didn't say anything about that.
Well, a lot has changed in my practice. Mayo Clinic Sports Medicine has really evolved over those years. Proud to say that we're now internationally known for taking care of athletes and for education and research in the area of sports medicine and orthopedic surgery.
You know, it was interesting when I was a young athlete, when you guys were young athletes, nobody got concussions. Now kids get concussions. Or maybe we did get concussions and we just didn't know it.
I think that's probably the correct answer. Back in the days when we were playing, there was really very poor recognition for concussions. The entity was not easily diagnosed. We didn't understand the symptoms, the signs, the tests that are required to make the diagnosis. So I do believe that they've always been present. We're just now better at identifying concussions.
And better at treating them?
We're getting better. We've learned a lot, even in recent years, about how to manage concussions. There needs to be a short time for physical and cognitive rest, but now we're exercising our athletes quicker. There's some exciting new research looking at dietary supplements and medications, which actually could reduce the severity and longevity of symptoms.
Dietary supplements?
Yes, there's some research from our military colleagues with blast trauma victims, soldiers who have been treated with a variety of substances. One's called N-acetylcysteine. There's also some other dietary substances which have been shown to have some promise.
You remember back in the day when somebody got their bell rung, we used to call it, they would break one of those ammonia salt things and have you smell that and get back in the game.
Bad idea for sure. So now we have a motto, which is when in doubt, sit them out. So certainly any young athlete in general, even suspected to have a concussion, should be immediately removed from play, should be evaluated by a qualified healthcare provider, properly diagnosed and treated, and then cleared for return to play by that medical professional.
What do you think of Bob Costas's comments about football being a dying sport and that fewer and fewer parents were going to let their kids play football because of the long-term consequences of multiple head injuries?
Well, it's certainly a concern. We know that contact and collision sports do carry risk of injury, including concussion. Football is notorious for that because of the nature of the game with frequent hits to the head and repetitive blows, actually, which may not cause a traumatic brain injury, but there's concerns about the additive or cumulative effects. We know in our youth that the most dangerous sport for concussion happens to be football, in large part because there's so many players who are involved. But football is responsible for about 60% of concussions in high school athletes. In males, it is the number one sport that causes concussion, whereas in females, it's actually soccer.
What about the age to start organized sports? Because maybe not in all parts of the country, but definitely where we're at in Minnesota, those hockey kids start at 3 years old, 3 or 4 years old. Is that too young, or when should you start organized sports?
Well, I think you should start as soon as possible because, as we will discuss, the benefits are overwhelming, and learning some of the motor skills, coordination, body control, not to mention having fun, I think has no age minimum. The problem really lies in large part with parents and coaches. And that's due to one term called professionalization, where you take a little kid who's having fun and try to put it in the perspective that they're going to get a college scholarship or end up playing for the Minnesota Wild, when actually you should just let them have fun. Secondly is specialization, where you participate in only one sport year-round. And I think there's some real detriment to that, because you lose the opportunity to learn other skills that you can gain from other sports. Actually, 7 out of 10 U.S. Olympic athletes played multiple sports in high school. So it shows you that you can reach a world-class level without super specialization at a young age. Not to mention the fact that year-round participation in a single sport actually increases the risk of injury because of overuse and a lot of other different factors.
So you talked about there are a lot of benefits to youth organized sports. Talk about some of those.
Well, I think first and foremost is fun. I think all of us remember playing sports and the enjoyment of getting on the court, the field, the pool, the rink. You make tremendous friendships. Some of my best friends to this day are my former teammates who I played youth and high school sports with. Clearly, there's many physical benefits. You can develop your energy system, have more endurance. It's healthy for muscles and bones. It's been shown that sports participation will decrease the risk of obesity, which is the number one problem we have maybe in our youth right now, with up to 30% of our young people being classified as obese. And we know the consequences of that in the future, things like diabetes and sleep apnea and all kind of other medical conditions that are associated with lack of exercise and obese body habitus.
So youth obesity is a huge problem in adults, but also in youth. But the activity will help overcome that.
Yes, it's been shown actually that those youngsters that participate in sports, in youth sports, are more likely to exercise as adults and continue recreational sports and fitness activities. So it really is a lesson for life. In addition, of course, there's tremendous social and psychological benefits. You learn things like teamwork and leadership and how to win and how to lose, which may not be apparent to a lot of people. It's been also shown that participation in sports decreases stress, anxiety, cigarette smoking, drug abuse, alcohol abuse. So there's so many potential advantages from all those different aspects of life.
I know that you have put some limits or suggested some limits with regard to contact in hockey and football until a certain age, right? Tackling,
correct,
et cetera. Tell us about those guidelines.
Well, I think that if we look at injury prevention in sports, we have to understand injury epidemiology, which means we have to learn who gets injured, how they get injured, how often it occurs, how severe it is. Once we know about the epidemiology, we can then target different strategies for prevention. And I like to always say that there's risk in life. There's risk of being a youth because you're active, you're fearless, and actually participation in team sports is probably less risky than bicycles, trampolines, skateboards, playground equipment, and horses. So I think we have to be realistic about risk-benefit analysis. Therefore, we're not trying to get rid of team sports. We're trying to make them safer. And there's a lot of different strategies that we can talk about, and they're very sports specific.
All right, we're talking with Mayo Clinic orthopedic surgeon and sports medicine expert, Dr. Michael Stuart. He is also co-director of the Mayo Clinic Sports Medicine Center. It's time for a short break. When we come back, we'll talk about weightlifting and strength training in the youth of America and also dispel some concussion myths.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We're back talking with the co-director of the Mayo Clinic Sports Medicine Center, Dr. Michael Stuart. Dr. Stuart, we touched on it briefly, and that's the topic of specialization in youth sports. And you indicated that probably not a good idea.
Certainly not a good idea at a young age. We really do promote participation in multiple different physical activities and sport. I think it really does allow for better development, motor development of our young athletes, and it might even teach them skills that they don't learn in one specific sport. Sooner or later, if you're a very elite athlete, you do have to specialize, and you get to a certain point where if you want to excel, it has to become your main focus, but certainly not as a youth player.
What about strength training or weightlifting? When is it that teens or kids, when should you start doing that?
You could start strength training at a very young age as long as it's done properly. It has to be with good technique, good form. And I think it's very important that you don't learn strength training in a gym by older brothers or sisters. You have to have somebody show you the proper technique. And we need to differentiate between strength training, powerlifting, bodybuilding, and those types of activities, which are also done with weights or resistance. So when properly done with good form, strength training does have benefits and is safe even for our younger athletes.
How about some general comments about the prevention of injuries in kids who are participating in youth sports?
Well, a perfect example is what we've done with USA Hockey. I'm the Chief Medical Officer for USA Hockey. I'm involved in our Safety and Protective Equipment Committee that I co-chair. And we've come up with some strategies to reduce risk. For example, we know that a blow to the head can cause a concussion. Therefore, it's now illegal in youth hockey, even for an unintentional blow to the head. Even an accidental one is a penalty. We've eliminated body checking in games at the Pee Wee level. So now you cannot body check in games until age 13. And we've seen a very dramatic reduction in the risk of injury and the risk of concussion, about a 65% reduction in our Pee Wee players. We know in football, for example, that injuries occur commonly in practice, including concussions. Therefore, we need to look very closely at football practices and actually reduce the mechanisms that can cause concussion and other injuries when our athletes are training.
How is the USA hockey team looking this year for the Olympics?
It's going to be interesting. It's a different setup than usual since no players under NHL contract are allowed to participate. Our team has a variety of former NHL players. Our captain, Brian Giunta, longtime NHL player, former captain of the Buffalo Sabres and the Montreal Canadiens, will be a great leader. We have a wonderful coach and Coach Granato. And I think that it's going to be very interesting because we don't really know what to expect from all the countries.
Could be another Miracle on Ice.
We're hoping for it.
What a great movie that is. Don't you love it?
I just want to know, when it comes to youth and sports, we had kind of touched on concussions, knee injuries and shoulder problems. Are there risks for young athletes more than adult athletes?
Well, there's certain unique risks for young athletes because they're still growing. So, for example, in the throwing sports, there can be risks to growth plates and other ligaments, which we need to make sure that we can avoid. And that's why in baseball and softball, there's now pitch counts. We have to be very careful that we're not causing these overuse injuries by having our athletes pitch too many games, participate in too many leagues, throw the wrong types of pitches with poor mechanics. And therefore, another great preventative strategy is to monitor the number of pitches.
So that's a repetitive use type of an injury. So how does you're relying on a coach then when you're a parent, maybe you're the parent coach, but how do you monitor that? How many is too many? I mean, if I'm not a sports trainer and my 10-year-old is pitching baseball, what should you do?
Well, parents are ultimately responsible, but there are rules in place now. And I think that if we look at sports in general, enforcing the existing rules is a good place to start. A lot of injuries occur when the rules aren't enforced. And there's also been some rule changes which have made a big difference too. And I think that parents are ultimately responsible for monitoring their own children to make sure that even though one coach is making sure they're not pitching too many games on his team, they're also playing on a different team. And they're playing in a AAA, and they're playing for their high school team, et cetera. So it really does require personal responsibility.
All right, let's go back to the topic of concussion, because I know there's a lot of misinformation out there. Let's start with this one. You need to lose consciousness or memory to be diagnosed with a concussion. Myth or matter of fact?
Well, that's a clear myth. In fact, probably less than 10% of concussed athletes actually lose consciousness. They may also not have loss of memory, whether it's a retrograde or antegrade amnesia. So I think it all starts with education. We have to inform players, coaches, parents, officials, and healthcare providers about the symptoms and signs of concussion, and the fact that oftentimes the symptoms will evolve later. So you may not be able to accurately diagnose a concussion immediately after the injury. So it all comes down to having a high index of suspicion, removing that athlete from play, and then following up accordingly.
And how do you decide when to let them go back?
There's only one scenario in all of sport where you can let an athlete with a suspected concussion go back to play in the same game. That's if you're absolutely certain they don't have a concussion, which is very difficult to do.
But that's why young athletes have baseline exams done, correct?
Correct. There are some newer ways that we can diagnose a concussion. One is called the King-Devic test, which was developed in association with Mayo Clinic. It's a rapid number naming test that can be administered by anyone, a parent, a coach, a trainer, any kind of healthcare provider. And if that player takes longer to read this set of numbers than they did compared to their baseline, they have a concussion and they're removed from play.
Is it different when a teen athlete or a child athlete gets a concussion versus when an adult gets a concussion? Is it treated in a different way?
There are definitely some differences. First of all our youth, high school, collegiate athletes are student athletes. So we have to consider that they need to get back to learning in addition to sport as opposed to a professional athlete. The developing brain may react differently. There's also social implications of being away from school and from peers. So I think it is a very different scenario when we have a youth athlete concussed compared to an adult.
All right, how about this one? A player that has sustained a concussion is up to 3 times more likely to sustain a second concussion in the same season.
True. And I think it's also important to realize that there is a period of vulnerability. So in other words, if you return too soon, you're at increased risk for another concussion, which will likely have more profound symptoms and a longer recovery. So that's why we have to be very careful about returning an athlete to play who has symptoms or who has not recovered from their initial concussion.
What do you see in the future of sports and youth in sports?
Well, I always look at it from a multifactorial perspective. First and foremost, we have to emphasize sportsmanship and mutual respect. We have to remember that sports are fun, and we have to have that respect for our opponent. Secondly, we'll continue to make sports safer through a variety of different preventative strategies. Third, we can't prevent every single concussion or injury, but we should be better at diagnosing and treating them.
All right, we've been talking about the benefits and risks of youth sports, specialization when kids are young, and also concussions. With Mayo Clinic orthopedic surgeon, sports medicine expert, co-director of the Mayo Clinic Sports Medicine Center, Dr. Mike Stuart. Dr. Stuart, thanks so much for being with us.
My pleasure. Thank you.